Hi, this is Dr. Michelle Hansen. I'll be talking about global health today. Our objectives will be to discuss the impact of globalization on the health of populations and to identify global health initiatives that affect populations. So there's a lot of different global health organizations. You've probably heard of most of these. The one we hear about a lot is the Center for Disease Control, or the CDC. There's also the World Health Organization. There's many foundations like the Bill and Melinda Gates Foundation, the Clinton Malaria Initiative, and UNICEF. There's a lot of non-governmental organizations, or NGOs, such as the Red Cross, Catholic Relief Services, Doctors Without Borders, Peace Corps, and Save the Children. And then there's religious organizations such as World Vision, Samaritan's Purse, and Mercy Ships. Now, globalization is a term that shows how connected and interdependent all nations are becoming due to ease of travel, communication, and economic exchange. We saw this during COVID with how quickly the disease spread, how widespread the effects were on health and economics, and how easily nations were able to work together and communicate. There are benefits to globalization, such as the sharing of knowledge, technology, and resources. The negative aspects can be spread of disease, migration of the healthcare workforce, and economic markets affecting each other. An example is when the housing market collapsed, and markets all over the world felt the effects. So now we'll go over some of the major global health concerns. Climate change is causing health issues directly and indirectly. For example, extreme heat, flooding, droughts, and storms. These events can impact food security and water availability. Fires can affect air pollution, causing asthma and other health concerns. Those in vulnerable situations and low-income countries suffer the most. Climate change is one part of planetary health. What are some things that can be done to mitigate the effects of climate change or improve planetary health? It's good to think about that. Maybe you can think outside the box and come up with some solutions. The experts mention things like drought-resistant crops, increasing vegetation in cities to reduce heat, which would be great in Phoenix, and repurposing land use to adapt to rising sea levels. Many people in low-income countries have little or no access to healthcare due to lack of transportation, lack of finances, and lack of healthcare workers. Some places, even if you can get to a healthcare facility, they have no medications or resources to help. For example, when I was in Malawi, Africa, I was there for 2 years with the Peace Corps. My parents came to visit me, and we were on a rural road out to a area to see some zebras and elephants. The potholes there are huge. They're the size of cars, and we went up on a ledge to avoid a pothole, rolled the car over, and my mom broke her vertebrae and her clavicle, which we didn't know at the time, but she was in a lot of pain. But anyway, we couldn't get the car to roll back over so we could drive, so we were stuck out in the middle of nowhere with no traffic and no people. So I started walking with my aunt up this dirt road, and eventually a truck came along with a bunch of men with big rifles in the back, and they were actually park rangers. So they drove the truck over to where the car was, and we followed on foot. They were able to roll it back over, but it still wouldn't start. And so they drove us up the street to a lodge that we were going to where we could stay. Of course, it took a couple days to get a new rental car so we could drive back to a town that had a little hospital. And then the hospital, we went there, they didn't have an x-ray machine. There wasn't a doctor. He was home sleeping or something, and they didn't have any pain medication. So it was basically pointless to go there. And I'm sure a lot of people in countries who are sick or hurt, they know not to go to the hospital because there's just nothing there that can help them. Maternal and child health has to do with promoting women and infants' health before, during, and after pregnancy. And that's a huge issue in a lot of countries. More than 80% of pregnancy-related deaths are preventable. And if you look at the maternal mortality rates in a country or region, It can say a lot about access to proper and affordable health care. Almost 800 women still die each day due to complications related to pregnancy and childbirth. In some low income countries, the lifetime risk of maternal deaths is 1 in 49, compared with about 1 in 5,300 in higher income countries. The under 5 mortality rate is another focus in global health. Children in sub Saharan Africa have the highest mortality rates at 68 to 86 deaths per 1,000 live births. They often die of preventable circumstances like diarrhea, pneumonia, and malaria. Children with malnutrition are more likely to die from these health problems. Dengue fever occurs in tropical and subtropical regions of the world. It causes high fever and flu-like symptoms. It can cause bleeding, a severe drop in blood pressure, and death. Millions of cases of dengue occur around the world. There's currently one vaccine that can help, but it's not 100% in preventing dengue fever. Malaria also is mosquito-borne, which you've probably heard of, and they do have a vaccine for that, but it hasn't been very effective as well. And then there's a lot of zoonotic diseases, which diseases that can come from animals or where animals transmit to each other and then they die and there's not enough food for the people in the area. There's so many aid agencies and they all have different goals and priorities. They tend to overrun some countries like Malawi, and then there aren't enough of them in other countries that need them. They sometimes compete for resources and people to serve rather than working together. And there's a lot of corruption in how aid is given. Sometimes it's taken by groups that it wasn't meant for. There's also an imbalance in global health spending. For example, more well-known diseases like malaria get a lot of attention and funding, and other diseases go left without any treatment or research. Another problem is that once healthcare workers become skilled, they often leave underserved areas to go places where they can make more money for their families, which is understandable. But this leaves low economic countries with fewer skilled health workers. Nations in conflict always cause multiple health problems, as we've seen in Gaza. Here's a slide to show you the universal determinants of health model. You can see planetary health, which affects everyone. Under that, you can see economic systems, social hierarchy, and policy. With social hierarchy, this can be broad or narrow. For example, some countries seem to get priority in funding and policy making, while others don't have much influence or say. The same thing in many low economy countries between gender and age. For example, in Malawi, the man ate first, then the woman, and last the children. The man had the final say in everything, even health issues for the women and children. He sat in the chair if there was a chair. He got the mosquito net if there was a mosquito net. If a child was able to go to school, it was the male first and then maybe females if there was any money left. Finally, in that little area of the circle, you can see education access and quality, economic stability, social and community context, neighborhood and built environment, and healthcare access and quality. When creating training for other cultures, people come in and don't often understand the culture. So they can create trainings and education that won't work in the area they're in. For example, to help with women's rights in Malawi, we needed to focus on the men. The women already knew about family planning and how to prevent pregnancies, but the men would not allow it. So we had to convince the men that it was a good idea. Another cultural example is training in HIV and AIDS prevention. Certain cultural practices and beliefs made the training ineffective in Malawi. There was a belief that a man had to have sex with a virgin to cure AIDS. So these men with AIDS were sleeping with young girls and then spreading AIDS to them. Another cultural practice was that when a woman's husband died, she automatically became the wife of his brother. And so if the man died of AIDS, gave it to his wife, and then that wife married his brother, then she spread it to him as well. In many cultures, polygamy is acceptable and can spread diseases too. One village in Malawi did not believe in latrines, so they had a lot of fecal waste that spread diseases. And then another thing is some agency came up with a good idea for irrigation in Malawi, but they used some sort of pump where you had to move your feet up and down like a kind of like a stair stepper to get the water to come out. and the men tried it and then they refused it because they were too tired to have sex after using it. Another factor in other countries can be literacy. If someone cannot read or comprehend posters, it's pointless to post a bunch of signs to promote public health. In many countries, women are not educated. If the family has to pay for school fees, it makes more sense to pay for a son who can go out and support the family. So some of the women can't read. Also, many countries have no roads or access to healthcare. In rainy season, the roads flood, and then when they dry, they're full of potholes. I saw this happen in Malawi. Vaccines can be difficult in countries where electricity is not reliable. Vaccines have to be kept at a certain temperature to remain viable. And if the electricity goes out a lot, as it did in Malawi, the vaccines won't be any good. Finally, many rural areas are difficult for healthcare education to reach due to roads, flooding, or even violence. Like I mentioned in Malawi during the rainy season, the roads would flood so that cars couldn't get through, and you would just have to stop the car and wade through the water to get where you were going. And then when the water dried up, the potholes would be so huge it could be dangerous to drive. Um, in Pakistan, polio vaccinators were being shot and killed because the community thought the vaccines would sterilize them. So there's a lot of cultural and social issues that have to be overcome with public health in the global areas. Nurses' role in global health. There's a lot nurses can do in the global health field. There's a lot of jobs, some paying and some volunteer, where nurses can go into a community and provide health care or education. Nurses can help shape policies based on research, and they can assist in public health crises like COVID. Most nurses took shifts out in the vaccine drive-through areas so that everyone in healthcare could get vaccinated quickly during the COVID outbreak. Nurses can be advocates in their community and work setting. You can do a lot of research or read about research and bring evidence-based practice and innovative ideas to your workplace. And finally, nurses can integrate health science into nursing practice. A lot of the research goes unread and unused because healthcare workers often don't have the time or infrastructure to bring research into the practice setting. So that's something you could help with when you get into your new jobs. Okay, then I have some references here, but that's pretty much it for now. Thank you for listening.